So I'd just like to extend Michelle's welcome on behalf of the Harvard T.H. Chan School of Public Health to everybody who's gathered here today and all of our international visitors. I think this is just a wonderful tribute to Dimitrios and his colleagues and his work. And I'm very privileged to have known and worked with Dimitrios, and it's a privilege to reflect on his legacy and also introduce such a distinguished panel of speakers. We've heard some wonderful science, some new science. We're going to hear some more wonderful and new science. So I was just going to make a few personal reflections. I'm among the few of the older generation here who was both a student of Dimitrios's as well as a colleague. I was a student in my first epidemiology class, and he gave 2 lectures on infectious disease epidemiology. My recollection is that he didn't have any slides, he didn't have any overheads. He may have used the blackboard, but he just talked. And he talked in whole sentences, whole paragraphs, and kept the whole of our G1 auditorium spellbound through 2 lectures. And he was coherent, and we learned a lot of infectious disease epidemiology. He was also an infectious communicator in the way he approached his colleagues. We've heard some of that already. I don't think I ever sat down with Dimitrios and didn't feel better when I stood up. I think I became an assistant professor the day he became department chair. And I remember a few weeks before that, he was, finding out who people were. And I had a meeting with him, and he had actually read one of my papers. And he used a word that's not often used in conjunction with my work. He said it was scholarly. And, for about to be assistant professor, that was high praise indeed. But the more important thing was that he'd actually taken the trouble to, learn about what I was doing and actually read the papers and give advice. I doubt I'm the only person here who Dimitrios on one time or another paid a slightly hyperbolic, over-the-top compliment about their work and accomplishments. But it was just wonderful how upbeat and positive and optimistic he was in those conversations, which does contrast with what many of us epidemiologists do in terms of nitpicking about details and tearing things apart. Dimitrios was definitely a builder both of science but also careers, and he really knew how to communicate with his colleagues in the most positive way. Even when he had bad news to deliver, he did it in the most courteous and respectful way. I remember a few years ago, I'd spent a lot of time on a commentary that I thought was, pretty interesting and important, and people should read and might actually change some minds. And he said to me, the word scholarly again, I loved your very scholarly commentary. And he waited a beat, and he said, too bad you published it in the wrong journal. And turned out it was completely right. I don't think it's ever been cited. But he really had a good sort of grasp of the field and how to have an impact. He was also able to write mini masterpieces of, again, polite, respectful disapproval. I was going through some old emails, and I discovered this email he sent to somebody who had submitted a manuscript, and he was a co-author. Dear X is not here. You may wish to find another rationale for studying prostate cancer and breast cancer together in your important project. Most researchers would not agree with your statement in the background of the abstract that the etiology of breast and prostate cancer may be similar. Thus, I'm sure you're not really surprised that your thorough study failed to replicate the previous results. With best wishes and many thanks, Dimitrios Trichopoulos. So that paper got substantially modified. I remember many times when he would open an email with, please forgive my lack of knowledge of more than the most basic statistics. But, and then he would put his finger right on the methodologic flaw or the sophisticated and subtle statistical mistake that somebody was making in the paper. So all of this, I think, was summarized in Michelle's interview with Dimitrios in Epidemiology, where in answer to one of her questions, he said, quote, "In science, we need to be kind. Disagreement in science requires scientific arguments and not personal hostility and rudeness." And it really said it all about his approach to his colleagues, his students, all of us who had the good fortune to know him. So he was optimistic. He was generous. Another example of his generosity was in the 90s, he handed over to me, he didn't have to, nobody asked him, but he handed over to me the Harvard Center for Cancer Prevention, and I became the director. A little later, at another point in time, he suggested to the dean that the dean split the Vincent Gregory chair, and so I had the honor of being a Vincent Gregory professor with Dimitrios for the last 10 or 12 years. And so those two connections are very dear to me, and he did those only because he thought they'd be good for my career, my profile, and that's not the norm, I can assure you, as acting dean. That level of generosity really made him distinct and distinctive. Along with his optimism and generosity, there was patience. Maybe forbearance is a better word, but I'll go with patience. And I have the honor of being an editor with Hans-Olof Adami and Dimitrios of Textbook of Epidemiology. When we got together, we would always agree that Hans-Olof did the lion's share, Dimitrios did the next most amount of work, and David Hunter was trailing the pack by a long way in terms of input. But when he had reason to talk to me about my slowness in turning things around as we tried to get, the book out the door, not once but twice, he'd always say something, and I can say this because Hans-Olof's not here, I guess, but he'd always say something like, "David, I know how busy you are and how many responsibilities you have and how hard working you are, but Hans-Olof doesn't understand that. Can you please finish your work on chapter X?" So most people would have put it quite differently, and I'm very glad to say that in honor of Dimitrios, the third edition is being edited by Hans-Olof and myself and Pagona and Lorelei, and it'll be dedicated to our friend and colleague and mentor, Dimitrios. And finally, with his optimism and generosity and patience was also his stamina. I said earlier, I was appointed assistant professor about the time, I think the same day that he became department chair. I think it was about 10 days later, he had a myocardial infarction, and I remember visiting him in the Deaconess Hospital a few days later, and he was obviously chafing to get back to work. So I guess nobody was surprised, or at least Trudy and Doris weren't that surprised when he materialized at the door of the chair's office with his suitcase in his hand, having checked out of the Deaconess and walked down Longwood Avenue to get back to work a few days before he probably should have been discharged. It wasn't his last myocardial infarction. He had other serious illnesses, surgeries that most of us would have just decided to put our feet up for a couple of years to recover from. But he just loved his work, and he loved his colleagues, and he kept on working. And this really came home to me. I did a quick PubMed search on joint publications, and the first joint publication I had with him was in 1994, 21 years ago. And in the next 10 years, while he was department chair, and I saw a lot of him, there were 5 publications to 2004. In the subsequent 10 years, at an age when most people are retired or slowing down at least, there were 63 more joint publications. And according to Science Citation Index, 2014 was his most prolific year ever. in terms of co-authorships. So he was speeding up, not slowing down. And it was a real signal to all of us that, that dedication and drive to do better and solve some of the problems that we're trying to solve in public health was absolutely key and undiminished all the way to his end of his life. So Dimitrios, optimistic, generous, patient, full of stamina. Hans Olaf in the remarks compared him to a Greek island. I like to think that he was our Jason, sailing between the different islands of scientific inquiry. And it was certainly a great honor to me to be an Argonaut in his crew while he went on the search for truth in cancer epidemiology. So with that, it's a great pleasure to introduce the panel, who I suspect will talk a little more about the science. And we actually have our first speaker on video. He had a personal emergency and couldn't come up, but he was able to record his talk. It's Paolo Boffetta. I did a search on him. 42 joint publications. First was in 2005 with Antonia as first author, Modified Mediterranean Diet and Survival in the British Medical Journal, a landmark paper. And Paolo is professor at the Icahn School of Medicine at Mount Sinai in New York City, also adjunct professor at the Harvard T.H. Chan School of Public Health. And if I knew which button to press, we could bring up Paolo, but thank you, I will get some help.
Good morning, my name is Paolo Boffetta. I work at Icahn School of Medicine at Mount Sinai in New York. It's a great pleasure and a privilege for me to make this presentation today at the symposium honoring Dimitrios Trichopoulos, which unfortunately I cannot attend. I had the pleasure, the fun to work with Dimitrios for many years, and also to teach a class on global cancer epidemiology during the winter session in the school during the last few years. And in that class, Dimitrios was teaching, one of the lectures Dimitrios gave was on liver cancer, because he was really very fond of the work that he has done in this area. And in fact, I'm using the format of the slides that Dimitrios showed in that course, and I will show some of the original slides that he used. So I will discuss liver cancer and hepatitis viruses, but also his work on tobacco-related carcinogenesis. We know today that hepatitis B and hepatitis C are the major causes of liver cancer on a global scale. These are some of the recent estimates. About 80% of total liver cancers are caused by either hepatitis B or hepatitis C, and this represents almost 5% of the global burden of cancer. So these are major causes of human cancer, and the vast majority of these cases are in China, in Asia, and in other developing countries. I would like to thank Michelle, David, Antonia, Padona, and all the other organizers for giving me this opportunity to present some of the very important work that Dimitrios did over the course of several decades on major risk factors for cancer, in particular hepatitis viruses and some aspect of tobacco smoking. I had the great pleasure to work with him in a short course in the winter session in the school over the last few years. And one of the lectures that Dimitrios gave each year was on liver cancer and hepatitis viruses, because he was really very keen on the work that he has done in this field. And in fact, I'm using the layout of the slides he was using in this course, and I will show a few slides from his presentation. So we know today that hepatitis B and hepatitis C are major causes of cancer in humans. You see in the slide some of the recent estimates of the number of liver cancers caused by these two viruses. They represent about 80% of total liver cancers and about 5% of the total burden of cancer. And the vast majority are in China, Asia, other Asian countries, and other low-income countries. We know all this today, but this was not really known when Dimitrios, with other colleagues, started his early work on the possible long-term chronic effect of hepatitis infection. These are some of the very early studies that he was involved in Greece on the prevalence of hepatitis B in some high-risk populations, and they realized that Greece was a population with high prevalence of hepatitis B. And the idea that hepatitis B could be associated with liver cancer came really at the beginning from a descriptive epidemiology. And these are two early studies that Dimitrios did on the correlation between hepatitis B prevalence and incidence or mortality from liver cancer, in particular in Greece, which really helped to focus the attention on hepatitis B. He did, by the way, some studies on hepatitis A also, and was able to show that hepatitis A was not really associated with liver cancer. In 1978, Dimitrios published this case control study with 80 cases of liver cancer, 160 hospital controls, and 40 secondary metastatic liver cancers. He did this work with Edward Tabor from NIH, and Nubia Munoz and Alan Nielsen from IAC. There were a few other small case control studies from Asia published maybe in between 76 and 77. This was the first case control study in outside Asia in a high-income country. And this is one of the original slides that Dimitrios used to show in the course, where he was showing the very strong association between different markers of hepatitis B infection, in particular the sulfase antigen, the active infection marker, the first line, with the hepatocellular carcinoma. We know very well now that this is a very strong association. But he was very keen about the other column on the right, the fact that they did not found the same association with the secondary liver cancer, with metastatic liver cancer. And this aspect of specificity of the association, he thought it was, at that time, very strong argument in favor of a causal role of hepatitis B in liver carcinogenesis. And I think this was a very astute design to include a second series of negative cases in a way where you would expect not to see the association. This was the case. A couple of years after the publication of the first report on hepatitis B, they published other results from this study, which are very important. This is the first study which showed the interaction between tobacco smoking and hepatitis B infection in liver carcinogenesis. As you see from the slide, there is a strong association with heavy smoking in hepatitis B negative patients, cases and controls, and no association, or very weak association for those who are hepatitis B positive. And this again has been replicated many times, and we know this as one example of what we call negative interaction nowadays. Some 10 years later, Dimitrios organized a new case control study with the same design as you see here, hepatocellular carcinoma cases, controls, and secondary metastatic cases, a sort of negative group of cases. And they look at the other virus that was prevalent in Greece, hepatitis C. And this is the first analytical study showing the association between hepatitis C and liver cancer. Again, a positive association in the primary tumors, no association in the secondary, in the metastatic tumors. And this study really had a huge impact. And again, this has been replicated in many different cohorts, in many different populations. And as I described earlier on, now we know that hepatitis C is one of is the other major cause of liver cancer, together with hepatitis B on a global scale. Again, another original result from these studies was the interaction or the effect of the co-infection between hepatitis B and hepatitis C. This is another original slide from Dimitrios, in which the relative risk for those positive for both hepatitis B and hepatitis C was 20-fold, and those who were only positive for hepatitis C but negative for the surface antigen of hepatitis B had a 5-fold increase. So the two viruses are acting independently on hepatocellular carcinoma risk. The second part of the talk is on tobacco smoking, and one aspect that I want to present is the work on secondhand smoke. Again, we know today that secondhand smoke is an important cause of lung cancer in never smokers. This is a study that I did with one of the students from the school who attended our class with the estimate of the attributable fraction of lung cancer in never smokers in different populations attributable to secondhand smoke. And we know now that it's a major, relatively important cause of lung cancer in never smokers, in particular in Asia. Again, as you see, our estimates here were in the order of 12 to 20%, depending whether they're talking about men or women. In 1981, Dimitrios published the first analytical study on secondhand smoke and lung cancer. The publication came around the same time as another paper by Hiroyama on the cohort of Japanese women that he had run in Japan, and the concomitant publication of two studies with different designs. This was a case control study in two different populations with very similar results. Again, was a very strong piece of evidence that this can be a cause or a causally related factor to lung cancer. This was the first study in 1981, published in the International Journal of Cancer, as you see, with Brian McMahon as a senior author. 2 years later, they published an expanded study in The Lancet with a larger series of cases and controls, which replicated exactly the same results. And as we know, this association has been found now in more than 50 studies, and secondhand smoke is now considered one of the established causes of lung cancer in non-smokers. However, Dimitrios worked on other aspects of tobacco-related carcinogenesis. This is a study he published with Brian McMahon, Phil Cole, and David Brown in 1982, so at the same time as the early secondhand smoke study, on the possible reduction in risk of some of the estrogen-related cancers in smoking women. This was a cross-sectional study on estrogen level and in different groups of smokers. It was a study done in Boston in premenopausal women, and they showed for the first time in an analytical study that indeed current smokers had a lower level of estrogen, estradiol, and estriol compared to non-smokers. And ex-smokers where this effect was sort of disappearing, it was no longer present after quitting smoking, which again, this is another important aspect of tobacco-related carcinogenesis that has been then followed by many other studies. So finally, I would like to present a couple of studies I did with Dimitrios over the last 10 years. This is the first comprehensive analysis of a marker of chronic inflammation, C-reactive protein, CRP, and cancer risk. We used the EPIC-GREASE study, and we analyzed all cases of cancer that were diagnosed at that time, about 500 of them. And as you see from the table, we found an association across all cancers. The association was not very strong, 20% increased risk for one increase in standard deviation of CRP level, but was present across multiple cancers, digestive cancers, respiratory, genitourinary, and also hormonal-related cancers. Before this study, there were a few smaller papers on colorectal cancer, And our study was really the first to try to look at inflammatory markers across the whole spectrum of cancers. The second study, etc. And the last slide I want to show is again taken from the lecture that Dimitrios was giving, is a comprehensive analysis of risk factors for hepatitis C, for hepatocellular carcinoma, for liver cancer, that he led in the overall EPIC cohort a few years ago. And these are the main results published in 2011, where we looked at both all the risk factors in a sort of comprehensive way: hepatitis B, hepatitis C, BMI, heavy alcohol intake, and tobacco smoking. And these are some of the strongest results showing an independent effect of each of these risk factors on liver cancer. And obviously this represents a much stronger approach compared to the early case control studies, and in a way really represent a continuum in the work that Dimitrios did on this very important cancer and the major risk factors. Working with Dimitrios has been, for me, a source of great pleasure and great fun, really. And I learned many lessons over the years. These are some of the take-home messages that I can summarize today, going particularly through this story of his work on the major modifiable risk factors for liver cancer and the lung cancer. He was really very clever in taking advantage of the characteristics of the available populations, in particular the population of Greece. High prevalence of hepatitis B, hepatitis C, very low prevalence of tobacco smoking in women, and obviously you need some luck to be the person who comes with the right idea at the right moment. But I think the second point is more important, the fact that really he has always been able to link the epidemiology observation with a very strong reasoning in terms of medical and biological mechanisms that may underline these associations. And he was extremely careful in considering different sources of bias. He's been working a lot with case control studies, and he was fully aware and very open about possible limitations. Some of the associations that he found in case control studies were so strong that really were robust even to some minor bias. But for example, in the case of second-hand smoke, clearly bias was a much bigger concern. And in general, I think he was very also cautious and very careful in the interpretation of the findings. He really tried to replicate findings in multiple studies using different designs, and was really very good in determining important causal associations for major causes of cancer. I thank you very much and for giving me the opportunity to make this presentation.